Lyons with Advanced Chiropractic and Rehab. I'm here to give you 5 tips you should know, or 5 things you should know when considering going to see a chiropractor. Number 1 is chiropractors are real doctors. We go to school for quite a long time in order to be a physician. We have a considerable amount more training as physicians than, say, a physician's assistant or even a doctor of physical therapy. And for that reason, we end up going to school and learning pretty much everything, the same curriculum as traditional medical school. I tell people all the time, as a student in chiropractic college, we had pharmacology classes, obstetrics, gynecology, geriatrics, pediatrics, you name it. If you saw it in med school, we also got it in chiropractic college. So that brings me to the next number 2 on the list. You don't need a referral to come see a chiropractor. Since we are physicians, we are the specialists, especially when it comes to spine. As a matter of fact, chiropractic physicians as a whole generally have a very good understanding of the spine and back pain, and specifically what specific causes of back pain are. As physicians, we're able to properly diagnose your condition and rule out more serious problems. So many different things can manifest themselves as back pain, and this is why you should always start with a doctor to begin with. Because it might not be a back issue. It could be an infection or something more serious. And as physicians, we can do that. We routinely order lab tests, x-rays, MRIs, and make referrals to specialists if it is a condition we can't treat. So number 3, it's important to understand, because we are doctors, that chiropractic is a profession. It's not a treatment. Most people seem to think, it's all about getting your back cracked or manipulation. And while spinal manipulation is something that chiropractors perform on a routine basis with the vast majority of our patients, it's not the only treatment we provide. And I tell people all the time, I have a lot of patients that we don't adjust at all. And as physicians, we want to come up with and dictate the best treatment plan, and that's not always manipulative therapy. There are other things that we offer as physicians, and there are other treatment alternatives, and if it's something we can't help you with, we can certainly get you out to the proper physician or specialist to see in order to take care of that problem. Which brings me to our 4th. As a profession, there are many different types of chiropractors out there, just like you would see in the medical profession. It's the same thing with, there's chiropractic orthopedists, there's neurologists, there's internists, and there's a lot of subspecialties within the profession. I myself, I am board certified in rehabilitation and corrective exercise, and also sports medicine. I went to school and got 2 secondary board certifications for those 2 types of subspecialties. So obviously I practice a lot differently than, say, a chiropractic neurologist or internist, or one that specializes in nutrition. The one thing I do encourage patients when selecting a chiropractor, whether you're going to come to see us or you're not anywhere near us and you're looking for someone in your area, always select one that does have the extra board certifications or some type of continuing training or education after they've graduated chiropractic college. This usually is very good, because these types of doctors are usually up on their treatment and with the latest and most effective treatment types would be out there. And our last one, a lot of people think once you go to the chiropractor you always have to go, and that's simply not true either. When we open patients' eyes to the different types of treatment options that are out there other than just drugs and surgery, people start to really understand what we're about. One of the interesting things is I tell patients when they come in for back pain, chiropractic really doesn't treat pain. I know that's the reason why people come to see us primarily, but at the end of the day, we're trying to make the body work better. We're trying to, and we can incorporate a bunch of different types of treatments into that. That could be manipulative therapy, corrective exercises, lifestyle changes, stop smoking, eat right, exercise. All these things play into trying to truly correct the back issue, or even a knee or an ankle or whatever it is we're seeing before. Once we treat conditions, we tell patients all the time, there's some conditions that are definitely correctable, and that we can correct in a certain period of time. And then people come in with problems that it's more of a management issue. There's some people who have, really bad injuries or really bad problems with their back that might require some ongoing treatment or ongoing care. And that's where we actually have a lot to offer in that, because coming in to get manipulation or some corrective exercises on a semi-routine for a very bad back problem is certainly a much better alternative than taking opioid pain medication, which really doesn't do anything to help you function. So that's it. If you found some of the information we discussed in this useful, please like and share it. I'm going to have a follow-up video to this on the way that we diagnose and get to the root cause, so look for that. That'll be coming up. Thank you.